Approximately 2.8% of adults in the United States, over 7 million people, are living with bipolar disorder. As a doctor, I see firsthand how significant this portion of our population is, yet many still struggle to understand the realities of this condition. Today I'm diving deep into the complexities of bipolar disorder, its symptoms, types, and the lived experiences of those who face it every day. Let's embark on this journey together. Bipolar disorder, which was previously known as manic depressive illness, is a mental health condition marked by extreme mood swings. These mood swings include emotional highs, referred to as mania or hypomania, and emotional lows, known as depression. It's crucial to understand that bipolar disorder is more than just mood fluctuations. These episodes can significantly impact daily life, relationships, and overall well-being. When I describe bipolar disorder to my patients, I often compare it to a roller coaster of emotions. At one moment, they might feel on top of the world, filled with energy and creativity, and the next, they could be overwhelmed by feelings of despair and hopelessness. It's this unpredictability that makes managing the condition so challenging. Let's delve into the symptoms of bipolar disorder. These symptoms typically fall into two main categories: manic or hypomanic episodes and depressive episodes. During manic or hypomanic episodes, patients may experience increased energy or activity that feels almost electric. Thoughts can race and speech may become rapid during these episodes. It's as if the brain is on overdrive. There's often an exaggerated sense of well-being, a euphoric high that can feel intoxicating. Patients may feel invincible, like nothing can stop them. One of the most striking aspects is the decreased need for sleep. Patients can go days with minimal rest, feeling perfectly fine. They often find themselves working late into the night, driven by an unstoppable urge to create or accomplish. Unfortunately, this can lead to impulsive or risky behavior. Choices made during these episodes may later be regretted, whether it was spending money that wasn't available or taking unnecessary risks with health. During depressive episodes, the lows can be crushing. Patients often feel enveloped by sadness or hopelessness, as if a dark cloud is hovering over them. It's hard to find joy in things once loved. Fatigue sets in, and even simple tasks can feel monumental. Some days, getting out of bed feels like climbing a mountain. Concentration becomes difficult, and the mind feels foggy. Patients struggle to focus on work or engage in conversations. The most distressing part of depression is the intrusive thoughts about death or suicide. It's a place no one wants to revisit, and it underscores the importance of seeking help. Understanding these symptoms is crucial as they manifest differently for each person. For many, the misinterpretation of these symptoms leads to misunderstandings and stigma. As a doctor, I can tell you that there are several types of bipolar disorder. Recognizing which type you or a loved one might be experiencing is essential for effective treatment and understanding. Bipolar wine disorder. This is characterized by manic episodes that last at least 7 days, or by manic symptoms that are so severe that immediate hospital care is needed. I've seen patients go through these intense highs, and it can be alarming. Bipolar II disorder. In contrast, this type involves a pattern of depressive episodes and hypomanic episodes, but no full-blown manic episodes. Many patients can go undiagnosed for years because the hypomanic episodes can be less disruptive. Cyclothymic disorder. This type involves periods of hypomanic symptoms and periods of depressive symptoms lasting for at least 2 years. It can be tricky because the symptoms may not be severe enough to meet the criteria for the other types, but they still create significant challenges. Understanding these types helps to paint a clearer picture of how bipolar disorder can affect individuals differently. Living with bipolar disorder can be a tumultuous journey. As a doctor, I often reflect on the experiences of my patients, and I know they are not alone in feeling misunderstood or stigmatized. It's essential to highlight a few key points that can help demystify bipolar disorder. It's a lifelong condition. While it can be managed effectively, bipolar disorder typically requires ongoing treatment. It's crucial for patients to stick to a routine, take their medication, and engage in therapy consistently. It's not a personality flaw. Individuals with bipolar disorder are navigating a serious mental health condition, not just exhibiting dramatic behavior. It's easy for others to misinterpret their actions, but understanding the disorder is key to compassion. Support matters. Having a strong support system can make a world of difference. Patients often find that sharing their experiences with trusted friends and family helps them feel anchored during their highs and lows. It's not just about having someone to talk to, it's about having people who truly understand what they're going through. Education is empowering. The more patients learn about bipolar disorder, the more empowered they feel. Knowledge can dispel myths and reduce stigma, allowing for more open conversations about mental health. It's vital for both those affected and their loved ones to educate themselves. Reflecting on the journey of my patients with bipolar disorder, it's often a roller coaster ride of emotions and experiences. There have been times when they felt utterly alone, grappling with the highs and lows. But over time, many discover a resilience they never knew they had. I remember a particularly challenging episode for one patient when they hit rock bottom. It was a time filled with despair, and they felt like they were drowning in darkness. But through therapy, support groups, and their determination to seek help, they slowly began to find their way back to the surface. It wasn't easy, and it took time, but they learned that it's okay to ask for help. There's immense strength in vulnerability. Today, they focus on the hope that comes with understanding and managing their condition. They've found strategies that work for them, and while they still have their struggles, they also have tools to navigate them. Treating bipolar disorder often requires a multifaceted approach, which is crucial for effective management. Here's what we recommend. Medication. Mood stabilizers, antipsychotics, and antidepressants can help manage symptoms. Finding the right medication can take time and patience, but it's a vital part of treatment for many. Therapy. Engaging in psychotherapy, especially cognitive behavioral therapy, CBT, provides patients with coping strategies to deal with their emotions. Therapy sessions teach patients how to reframe negative thoughts and manage mood swings. Lifestyle changes. Regular exercise, a balanced diet, and adequate sleep significantly contribute to mood stability. Exercise in particular can be a game changer. It helps release pent-up energy and improves overall well-being. Support groups. Connecting with others who understand similar experiences can be incredibly comforting. Support groups provide a safe space to share and learn from one another, reminding patients that they are not alone in this journey. Education. Educating oneself about bipolar disorder empowers patients to advocate for their needs. Understanding the disorder helps patients communicate better with healthcare providers and loved ones. Bipolar disorder is a complex condition that affects millions of people, including many of my patients. But it's essential to remember that with the right treatment and support, individuals can lead fulfilling lives. I've seen firsthand that it's okay to struggle, but it's also okay to seek help. If you or someone you know is navigating bipolar disorder, I encourage you to reach out for support. There's strength in seeking help, and there's hope for a brighter future. If you found this video helpful, please give it a thumbs up and share it with someone who might need it. Don't forget to subscribe for more content related to mental health and wellness. Together, we can spread awareness and understanding about bipolar disorder. Thank you for joining me today, and remember, you're not alone in this journey.